Hello, I'm Dr. Brandt Gibson, and we're going to talk a little bit more about hammertoes. Today, the idea is surgical treatment for hammertoes. Reminder, hammertoes are contracture of a joint where it's going to usually cause curling of the toe that will look like it's a claw, basically, or whatever, and it causes it to rub on the skin or rub on the top of the shoe or the bottom of the foot. Basically, it's curved and hammering on the ground. So that took a while to explain. I'm not sure exactly why, but the point is, hammer toes are a big deal. They cause the foot to not look as good, but more importantly, they can cause pretty significant pain. They can create wounds. They can actually cause infections that may ultimately lead to amputation if they're not treated. So, what are the options for treating? What are the surgery options for treating hammer toes? There are several. There are certain soft tissue type procedures. So certain types of hammer toes you can actually do by basically just releasing the joint, possibly lengthening tendons, stuff like that. That can actually do the job. So one is you can do a tenotomy where you actually lengthen the tendon. One way is you can actually do a derotational arthroplasty where you're actually just rotating the toe based on using skin. So because the hammer toe, instead of going down to the ground, it's curved underneath, and they just curl it back, and it can actually allow it to fix it. The other type is bone surgeries. And bone surgeries, there's really two classes of bone surgery. One is called an arthroplasty, and one is called an arthrodesis. Arthroplasty means that you take a portion of the joint out and then close it. So it's taking a little piece of the bone out that gives you room to go straight again, and then the soft tissue structures around it, skin and tendons and so forth, can actually finish the job. Arthroplasty is done on toes that don't have a high risk of it coming back. Typically, it's going to be third, sometimes fourth and fifth are more common. Or arthrodesis, which is actually fusion that joint. So you've got a curl joint. What you're going to do is you're going to straighten it out and fuse it so it can't curl again. The big idea is with the second toe, for example, this is usually what's done. You want to fuse that joint so it doesn't come back. And there are multiple different ways that you can actually do that. There are times when you can put a pin that's sticking through the toe. So if you had someone says, "Oh, well, I had a pin in my toe," most commonly it's a big pin that's holding it in place while it heals. It's in there 3-4 weeks, and then you take the pin out, and because of the scar tissue, it actually will help hold it straight while it finishes fusing the bone. Number two, which is more common now, is there's actually implants that can go inside the bone, and there are multiple different types. The idea is you take one bone, other bone, put the implant in, put them together, and it holds it like the pin does, but it can stay there forever until the bone is completely fused. The third option is a little bit more aggressive. You say, okay, I'm going to reshape the bone so I can actually position that toe where I want to, and then fuse it. And so a lot of times with that, it can be a ball and socket type thing, or a pin and hole, or it can do certain types of implants, but typically you're going to round that joint so it's not just end to end, which are usually flat, but you're actually able to position exactly where you want it. So you kind of ream one side and core out the other, so you actually can get a true ball and socket type joint, which allows you to position more effectively, and then you fuse it with some kind of a device as well that holds it in place. Sometimes it's the same thing, a pin or an internal implant. This is Dr. Brandt Gibson, and these are some of the surgeries that you can actually do for hammer toe deformities. Again, we recommend surgery if it's interfering with life, and if you don't know what that means, watch the previous video and you will be able to understand that. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 256.